I'm Dr. Tara Scott, founder of Revitalize Medical Group. 16 years ago today, I was undergoing in vitro fertilization in the hopes of conceiving. I had problems getting pregnant with any of my children, and thankfully, through the blessing of modern medicine and fertility drugs, I have 3 healthy children. However, what I didn't realize then is one of the reasons I couldn't get pregnant is because I wasn't ovulating. Normally, in a menstrual cycle, you produce an egg that produces estrogen. Somewhere in the middle of your cycle, that egg is released, and after it's released, the shell of the egg produces progesterone. These 2 hormones need to be balanced naturally in your body for you to be able to feel good. Although the hormones are geared at reproduction, what we don't realize is that later on, when fertility is not a concern, the imbalance of these 2 hormones can cause lots of symptoms such as night sweats, problems sleeping, weight gain, fatigue, and other issues. So if you find yourself in your 40s not trying to get pregnant, but still having maybe normal cycles or maybe irregular cycles with any of those symptoms, you're not too young to have hormonal imbalances. Traditional lab testing done by your family doctor or GYN will only attempt to see if you're in menopause, which is only after the definition of 1 year without a period. So perimenopause can last up to 10 years prior to that. And I see a lot of patients who have gone infertility treatments that later have problems with their hormonal balance. You're only born with so many eggs, and when you run out of eggs, that's menopause. And at the rate that I was getting rid of eggs, 5 eggs here, 17 eggs during my retrieval, that accelerates menopause in a lot of fertility patients. And it's a known fact that they usually go through earlier menopause, which means they'd have symptoms earlier. So you need a sophisticated way to check your hormones, and a lot of times at Revitalize we use saliva testing to detect the amount of hormones in your tissue, not necessarily what your ovaries are producing. And that way I was able to identify my hormonal balance and correct it.